This is chapter 4, part 3, where we're going to be talking about the common disorders of the digestive system and microbes that affect your overall gut flora within the large intestine, prebiotics, probiotics, all those fun things. So, we will be diving into some of the more common GI disorders. To begin, though, understand that your large intestine, especially, is filled with good microbiome, with good gut microbiota. They are diverse, they are different from person to person, and they are very beneficial in helping you maintain vitamin K, thiamine, biotin, overall body metabolism. They allow in the fermentation here and metabolization of undigested fibers, which we will talk about here in a minute, as prebiotics, which in turn can lead to intestinal gas known as flatulence, which just means that you have good gut flora, right? Um, to help maintain this good microbiome, it takes a variety of foods, and that balance is important. When that balance gets thrown off, it can lead to intestinal dysbiosis. Dys meaning bad or painful, bio meaning life, osis meaning abnormal condition of. So, this is where there is an imbalance in your gut flora due to either antibiotic use, inflammatory stress, poor dietary habits, starvation, whatever it may be. That can lead to intestinal dysbiosis, which in turn can lead to chronic, more serious diseases of the GI tract. There is such a thing as there is such a thing as gut microbiota transplantation, also known as fecal transplants, which are used and have been and are very beneficial in treating and helping to treat C. diff, ulcerative colitis, and Crohn's disease. You have what we call probiotics for life. These are your live beneficial gut microbes that are cultured and that we consume, okay, in the form of bacteria, yeast, and I recommend eating whole foods and not necessarily always taking gummies and those kind of things. Eating whole foods instead of these probiotic gummies. Not that they're bad, but you're going to get a lot more benefit and nutrients from the whole food, hands down, all the time. Okay. So go for whole foods whenever possible. And then you have what we call prebiotics. These are helpful in supporting the survival and growth and maintenance of the good gut microbes that you have. And these are found in your fibers, known as your fruits, vegetables, and whole grains that we spoke about way back in part 1 or chapter 1, I think it was. You have various types of inflammatory bowel diseases, your IBDs. This is a general name for a group of chronic diseases such as ulcerative colitis and Crohn's disease. Really, any type of inflammatory disruption of the GI tract and its absorption is a type of inflammatory bowel disease. The first one here is ulcerative colitis, colo here meaning colon or your large intestine, itis meaning inflammation of. These are sores within that epithelial lining of your lumen of your small intestine and or lumen of the colon that prevent the absorption process. It's kind of like rubbing sand in a wound in a way. It's going to be painful, cause abdominal cramps, possible rectal bleeding because it's an open wound internally, diarrhea, weight loss, so forth. Then you have Crohn's disease that mainly affects the ileum of the small intestine and the colon. And there again, signs and symptoms are diarrhea, abdominal cramps, loss of appetite, weight loss, of course, because they cannot absorb food. And it's a real hard one to treat because these foods that can lead to problems vary from person to person. Okay. Let's go through some of the more common types of gastrointestinal disorders. First one here, constipation. The diagnosis for constipation is three or fewer difficult and infrequent bowel movements per week. Now, don't panic if you're not having three bowel movements a week. Not everybody does that, especially if you are eating a healthy, low carbohydrate or high protein diet. You are going to absorb, excuse me, there's going to be fewer waste. There's going to be less waste in the food that you eat. So, more absorption, less waste, less to have to defecate out. So, in general, what makes constipation a problem is that it's difficult and can be painful. Okay. Or at least it's what I tell my patients. I don't get odd, I don't, have them begin to worry if you're not having three bowel movements a week. It's, let's look at what you're eating before we diagnose you with constipation. The common causes are older age, you have a slower gut bowel movements, you have slower peristaltic movements. Certain types of diseases and health conditions, such as diabetes, can cause gastroparesis or other types of intestinal paresis, slowing down of that gut mobility. Inadequate water and inadequate fiber are really the two big ones, and inadequate exercise and movement. Okay. Chronic constipation can and oftentimes does lead and will lead to hemorrhoids and what we call diverticulitis or diverticula, those small pouches that develop on the inside of the small intestine that can lead to difficulty in absorption and more pain. So, fiber and water, okay, dietary fiber and water help to reduce constipation. The opposite of that is diarrhea. This is where you have frequent watery, loose stools, usually caused by some type of bacterial or viral infection that the immune system, your lymph, your intestinal tract is trying to get rid of. So, the way to treat this is to make sure you maintain your fluids, make sure you are able to continue to keep down fluids and electrolytes, and definitely seek medical attention if you have bloody diarrhea, severe diarrhea in the very young and very old, okay, or diarrhea that is off and on for more than a week. You don't want that. You don't want to mess around with fluid loss in the body. Another type of fluid loss is vomiting, also known as emesis. This is the involuntary forcible expulsion of stomach contents and part of the duodenal contents out of the body via the mouth. So it's kind of like reversing gears coming up. It is usually the body's way of trying to get rid of some type of toxic substance within the stomach or duodenum, and or get rid of bacterial infection. Okay. It can also be due to neurological issues, due to motion sickness, hormonal changes during pregnancy that affect that gut mobility, and pain. Okay. Severe pain can cause vomiting and diarrhea, or excuse me, vomiting. And sometimes migraine headaches can become very severe. And the way to treat that is try to avoid solid foods, definitely maintain your liquids, and stay away from anything, or excuse me, and drink clear liquids and non-carbonated beverages, nothing that's going to be bubbly or minty and or peppermint flavors that's going to come up. If your emesis appears like it contains blood, if it is accompanied with fever or confusion or severe abdominal pain, do not wait in getting medical help. The next one here is called GERD or gastro, meaning stomach, esophageal, meaning your esophagus, reflux, meaning coming back up, disease, also known as GERD. You may know it as heartburn. It is that slow, gnawing, burning pain that is right above your heart. It feels like it's your heart, but technically it's your esophagus. So your heart is not the issue here. It is that area. Let me see if I can find the picture here. It's this area right here where the stomach contents is coming back up through the lower esophageal sphincter here up into the esophagus. And remember, your heart is right here, right below your sternum, or right underneath your rib cage here. So you can kind of see where the pain corresponds with where the heart is, but it is not your heart that is at issue. It is that acid reflux coming back up from the stomach. This leads to a much higher risk of esophageal cancer later on in life, and you do not want to mess around with these symptoms. Okay, get help for this. Risk factors include pregnancy, cigarette smoking, excessive abdominal viscosity or body fat, drinking alcohol, and eating certain types of foods like very high fat foods, spicy foods, greasy foods, peppermint foods, caffeinated foods, acidic foods, things like that. So if you suffer from GERD, small amounts, keeping the head elevated, lose weight if you can, quit smoking, obviously, and medications that will inhibit the stomach acid production when necessary. Then you have peptic ulcer disease. These are sores in the lining of the stomach, so gastric ulcers, whereas before we had ulcerative colitis, these were ulcers in the colon. This is gastric ulcers known as peptic ulcer disease. This is caused by the Helicobacter pylori bacteria and infection in the stomach that um, causes that mucosal lining of the stomach to wear down, and that causes pain. And so over time, the treatment of that is to try to get rid of that Helicobacter pylori bacteria, or at least just reduce the amount of it in the stomach and try to reduce the amount of stomach acid that is produced. Here is a very good example here of these ulcers within the lining. You see the rugae here of the stomach, those inner folds, but you also see where that Helicobacter pylori bacteria has eaten away at part of the stomach here and is very painful. And then you have irritable bowel syndrome, or IBS. This is bloating, gas, abnormal bowel absorption and bowel function, and severe intestinal cramps. This can come and go as well. There again, it comes in episodes. So we really don't know what causes irritable bowel, but it can be due to infections, emotional stress, that inflammatory emotional stress that people often get can lead to irritable bowel flare ups. And the way to treat it is, along with looking at poorly digested carbohydrates, which we'll get to in a minute, is to manage your stress. Okay. Um, get that sh- mental stress level under control to decrease the systematic inflammatory response within the body. That includes the GI tract. And then you have low food map here. Low food maps, these are poorly digested carbohydrates. Fructose and lactose are ones. The FODMAP or food map stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. So they're types of carbohydrates that are hard for the gut, for some people's gut, to digest. So it's recommended to just avoid those at all costs if you have irritable bowel syndrome. Ooh, and then colorectal cancer. The fourth leading cause, or the fourth leading cause of cancer recently. It is a fast growing cancer. that develops either in the colon or the rectum. The signs and symptoms are changes in the bowel movements, such as chronic diarrhea or chronic constipation, or what they call pencil thin stools, where something is blocking the rectum. And when the stools do come, they are shaped differently, pencil thin, very slight. Not being able to defecate completely, having bloody bowel movements and or dark stools, unusual tiredness, involuntary weight loss, chronic fatigue due to possible anemia. The other risk factors for colorectal cancer are age, unfortunately, a family history of colorectal cancer, having any other type of irritable bowel disease. There's a lot of research now leading to possible type 2 diabetes, increasing your risk for colorectal cancer. What they call processed meats or your highly processed meats, excessive body fat, being physically inactive, and of course, smoking and drinking. Um, Cigarette smoke and drinking lead to that chronic inflammatory response within the body. Silent, painless, but it's there. And it causes that internal inflammatory stress on the body that over time leads to all of these issues we're talking about. Treatment usually involves some type of surgery to possibly remove the cancer, possible chemotherapy, possible biological therapies, radiation therapies, and oftentimes they either have to go in and remove part of the colon and put in a colostomy, or try to treat it with chemotherapy and surgery. So, in review, common digestive system disorders, you have vomiting, also known as emesis, gallstones, similar to kidney stones that develop here in the gallbladder, ulcerative colitis, where you have those ulcers, those sores in the colon, irritable bowel syndrome, that malabsorption anywhere here along the small or large intestine that leads to that gas or bloating and pain. Crohn's disease. We didn't really talk a whole lot about appendicitis, but your appendix is here at the base of the ascending colon, and it houses good gut flora. We've talked about acid reflux or GERD, your peptic ulcer diseases, your ulcers that develop in the stomach due to that bacterial infection, diarrhea and constipation, and the causes and risk factors of those, and then finally your colorectal cancers. Okay. So, as always, please email me if you have any questions or concerns. Please read the chapters, complete the practice questions within the chapter, as well as doing your connect exercises. Reach out to me if you have any issues. I am here to help. Thank you so much.